March is Colorectal Cancer Awareness Month, and Texas Oncology wants you to know how to detect what is the second deadliest form of cancer in America for men and women. Jeff Hurley, colon and rectal surgeon at Texas Colon and Rectal Specialists, joined me to share more. I guess the first thing I'd like to know is, what are the most common signs of colorectal cancer? What would you notice?
So colorectal cancer does have some signs and symptoms, but really the important thing to understand is that many patients don't have any symptoms and can still develop the disease. That's why screening is so important, that we'll talk about. But the signs of colon cancer can be rectal bleeding, abnormal bowel habits, abdominal pain, also anemia, weight loss, fatigue.
Okay, you touched on this. You said that we want to talk about why screening is so important. Can you elaborate on that, what exactly that means?
Right. So colorectal cancer is actually a preventable cancer. And so if we get a screening colonoscopy, if polyps, which are precancerous lesions, are discovered, then those can be removed, and we've actually prevented a cancer. So we do colorectal cancer screenings for certain age groups, and that's a way that we can prevent the cancer.
So I know there can be some confusion about this. There have been different guidelines. So I guess, who should be screened for colorectal cancer? What are the best guidelines to go by?
So everyone that's healthy and has no symptoms, they've actually moved the screening age down to age 45. It used to be 50. Now it's 45 years old. But also, if there's a family history of colon cancer in your family, you'll want to be screened earlier. And then inflammatory bowel disease and people with a high-risk diet, smokers, diabetics. Speak to your doctor. Sometimes we move the screening recommendations down a little earlier from 45 in those patients.
So when you say colorectal screenings, exactly what are you talking about, and how often then should people get them?
Okay, so the gold standard is a colonoscopy, because, as I mentioned, the polyp can be removed and the cancer prevented. There are some other screening tests, such as virtual colonoscopy and some fecal chemical tests. Those are not as accurate as colonoscopy. So pretty much colonoscopy is universally recommended and covered by insurance plans now if you meet the screening criteria.
And how often do you get them? Because I know I had one a couple of years ago, I think. Fortunately, it was real clean. And he said, I think it was like 3 years later or something like that. Don't worry about it.
It depends. So if it's completely normal and there's no family history, you can go 10 years actually. But if polyps are removed, then oftentimes it's a 5-year or even a 3-year interval, depending on how many polyps were removed.
Okay, so how can viewers find out more about the symptoms, the screenings? There are a lot of questions here, and it's a very important subject.
Yes. So TexasOncology.com. You can find a lot of information about colon cancer and screening there. You can also call the number and speak to someone. We're happy to help.